I'm going to pass it over to Dr. Vazquez. Dr. Vazquez is one of my favorite attendings to work with. He is so kind, but so proficient. So I'm really excited to introduce you guys to him. We have a very unique and special pediatric emergency medicine program, and every attending is gold. And so with that, I'm going to introduce you to Dr. Vazquez, who is the Fellowship Director of PTM. You are muted.
All right. Hi, everyone. Can you see me? Okay, hear me? It's happy to see all you guys and have this meeting with you guys. I wanted to just talk to you about pediatric emergency medicine at Maimonides. About 80% of children who are seen in emergency departments in the United States are seen by general ER providers. So what does that mean to you? That means that most sick children that were presented to the emergency department will be managed by you. So when you are selecting a pediatric emergency medicine program, you better have a program where that's focusing on teaching you how to take care of children in the best, children that are in their sickest states. So Maimonides offers that. I came to Maimonides in 2007 after being a Peds EM fellow at Columbia. And I came here thinking, oh, it's going to be easier, not as busy. And I had my butt handed to me on every shift. The amount of sick children we see all the time, we see many sick children. The community, given that there's lots of sick children in the community, we get congenital heart disease patients, although we don't treat them, we don't do surgeries in our hospital. We still see children who are ill with congenital heart disease or all those other strange genetic disorders. The other thing that I think is special about our program is our chairman used to be the EM program director, or the founding EM program director. So he thinks that the emergency medicine resident education is very important, and therefore selects faculty and selects for opportunities for all of you guys to learn. So he supports our pediatric emergency medicine department. We have 10 Peds EM faculty members, and we have 7 pediatric emergency medicine fellows. If you guys are interested in going to Peds EM, it's also great to come to our program because we've had a few people who've graduated and gone to do Peds EM now. Our residents, I frequently get phone calls or text messages from them once they've graduated, and they say to me, oh, thank God, thanks so much for what you've taught me and what I've saw at Maimonides. I'm working with my co-attendings and they are not sure what to do with this patient, but I felt confident in knowing what I was going to do with this patient. So that made me feel good. It made me feel better. When you are considering to go, when you're choosing which program you may want to go to, it's very important you select a program that has lots of experience in the pediatric emergency department. In our program, the EM interns will spend two 4-week blocks in the Peds ED, and then in their second and third year, they will spend about probably 1 shift per week when they're in their EM block, so that the experience gets spread over the next 2 years. It's not block work, which is more similar to what a real general ER job is, where you'll see children and adults. So I think that opportunity is really good for the EM residents, where they'll spend 1 day in the north side, which is the acute resuscitation area, the next day in the south side, which is the general medical area, and then the next day they'll be in pediatrics. So they'll be like focusing and remembering all of those things. During your first year during your internship, we're focusing on a lot of general pediatric stuff. During second and third year, you're managing really the room and managing pediatric resuscitations. The other things I wanted to mention about our program is that we're one of the few trauma centers in Brooklyn. So that was one of the holes that we had in our training program. But when we became a trauma center a few years ago, I think it really rounded out our experience. Given that we have all of our EM subspecialties, it really has made the Peds EM experience amazing here. So I hope you choose Maimonides, and if you have any questions about the Peds experience, please feel free to contact me whenever you feel like. Let me know if you have any questions.
And echoing Dr. Vazquez, the PEDS experience, it's at least compared to my former classmates now at different programs, we just get such a huge amount of PEDS experience that we can walk away from this program feeling comparatively much more comfortable. The first year, you just get 2 straight months, boluses of seeing kids, and then by PGY 2 year, you're like he said, you're really managing the room. It's an odd experience from your first day, feeling uncomfortable of can I order Tylenol on any patients, to a year later, you see somebody and immediately know this little neonate is not well. Let's go down the peds recess pathway. Let's get started. And I think that is just an experience so unique to Maimonides, and especially with the level of PEDS traumas we get as well and PEDS resuscitations. It's just, you learn very fast.